Today, I had a lecture at Hong Kong about gastric ESD in Korea. I'm Junheng Lee, an endoscopist at Samsung Medical Center, Seoul, Korea. The symposium was held at Eaton Hotel, Chimsachi. There are 4 must-knows before starting ESD. Indications and skills for careful endoscopic evaluation for candidate lesions. Advantages and disadvantages of each instrument. Strategies for technically successful ESD. How to manage complications. And hands-on side-by-side training is required. Due to the time limitation, it is difficult to talk a lot about technical aspect of ESD. This is how I do the circumferential pre-cutting with the needle time knife. Left side first, right side second, and finally horizontal cutting of the proximal part. Location also matters. In this case, en face view of the lesion is easy, but close-up approach for ESD was difficult. So a large loop approach was used like this cartoon. Traction method is also very useful for lesions at difficult location. Management of complications is a great part of ESD education. Most perforations can be treated endoscopically without surgery. When the resection is big and close to the cardia or pylorus, short-term oral steroid can be used for the prevention of obstruction. The hospital stay for gastric ESD is usually 4 days. For the beginners, hands-on training using an ex vivo pig stomach model is a very useful method. Artificial mucosa, endogel, is a good alternative of ex vivo pig stomach. It was originally released in a paper box. But we are using the endogel with co-can gastroscopy simulator because it is more realistic. In the endogel ESD hands-on, traction method is usually needed due to the mucosa is not real. We are using Pentax Splash M knife for the endogel ESD hands-on training. Splash M knife is a new multifunctional ESD knife from Pentax company. It has a needle-type tip with hooking mechanisms. At the distal end of the knife, there is a metal plate which is useful for bleeding control even in retracted position. The length of the ESD needle is 2 mm in extended position and 0.5 mm in retracted position. In my recent experience with Pentax Splash M knife, I found three major advantages. First, the hooking mechanism is very useful for the submucosal dissection step. When a lesion is located at difficult location and the approach is not easy, I usually use the dual knife and IT2 knife for patient. But with the Splash M knife, I can do the procedure without using the IT2 knife. Second, the metal plate at the distal end of the Splash M knife provides enough contact area for the bleeding control during the procedure. Finally, the procedure time is much saved due to the water jet function. In a recent study from Japan, ESD using Splash M knife appears to reduce the usage of hemostatic forceps during the gastric ESD without increasing the adverse effect. It can reduce the total cost of the treatment. This is my first case of ESD using Splash M knife. It was 20 mm sized well-differentiated tubular adenocarcinoma in the mucosa, and the resection margin was free. In this recent ESD using Pentax Splash M knife, as you can see, the bleeding is minimal, and I can control all the bleeding using Splash M knife without using hemostatic forceps. Before starting ESD for the first time, beginners should have some experience as the first assistant. With some cases, the main operator usually gives the beginners to do part of the ESD steps. And this is the first procedure of my young fellow. The procedure was excellent. Telementoring using iPhone FaceTime app is a very useful tool for ESD beginners. International mentoring is also possible. If you want some real-time comments from me, send me an email at stomachly@gmail.com. For the foreign doctors, 1-week ESD training course is also available at Samsung Medical Center. It consists of introductory lectures, ESD observation, ESD conference and planning session, hands-on training using artificial layer endogel, and live pig. These days, I have used the new endoscope system called Imagina from Pentax for gastric ESDs. Imagina endoscopes have many advantages such as brighter image, water jet function, low weight, but as a therapeutic endoscopist, better close-up view and more angulation is the most attractive aspect. This is a recent gastric ESD with Pentax Imagina endoscopes. There is a small, too closely located gastric cancer lesions on the lesser curvature side of the antrum. This is the close-up view, indigo carmine spraying view, marking, circumferential cutting, submucosal dissection. This is the resected specimen. There are two round cancers. This is the final pathology. One tumor is 16 mm and the second tumor is 18 mm. Both of them was lamina propria cancer and the resection margin was free. This is another case. Close-up view, indigo carmine, circumferential cutting, ESD, and the final pathology was 32 mm sized mucosal cancer with negative resection margin. Ladies and gentlemen, ESD is widely performed for EGCs in the absolute indication in Korea. Annually, it is more than 7,000 cases. We are still very careful about expanded indication cases. It's done usually for flat signal ring cell carcinomas less than 1 cm. Starting the role of the first assistant is the beginning of learning ESD techniques. Pentax Imagina endoscopes and Splash M knife are making the ESD procedure much easier, not only for beginners, but also expert doctors. Thank you for your attention.